nurse. How are
Hi.
you?
Good. How about you?
I'm good. And congratulations.
Thank you.
Is this your first baby?
It is my first baby, and I'm very nervous about the breastfeeding. And they told me that they were going to send you in to kind of
Mm-hmm.
consult me about it.
Okay, we'll talk about breastfeeding and bottle feeding today. So, has your baby shown any cues that she's hungry?
Yes, she's been making some, like suckling noises.
Mm-hmm.
And so that's why I'm kind of have her ready to go here.
Okay.
Because,
Is she rooting around when your skin gets close?
yes, especially if I don't know if she can smell it or what, but when she's by my breast, it's crazy, like a baby bird. Yeah.
Okay. Well, this is actually the perfect time to start nursing your baby. To start feeding her is when before she's crying, when she starts showing cues. So first we're going to talk about your milk. The first milk that you're going to have experience is called colostrum. That is a really rich milk that has a lot of antibodies in it. It's really good for your baby for the first couple days before your mature milk comes in. That'll happen in a couple days. And that milk is actually very easily digestible for her. And there's two different kinds of milk. There is fore milk and hind milk. So you want to make sure that when you're nursing, you fully nurse on one breast, and then you can burp her, and then you can start on the other breast. You want to make sure that she gets both those milk consistencies.
Okay.
Also, the American Academy of Pediatrics does recommend that you exclusively breastfeed for 6 months. Then you can introduce food, but we would like to see you nurse at least for a year.
Okay.
And the more you nurse, the more your body will produce. So it's your body is going to be working with the baby. Every time that she shows cues, make sure you put her to your breast, not pacify her or supplement with bottles, and your body will begin to produce all that she needs.
Would pumping in between help that as well?
It would.
Okay.
Yes.
And then also, how do I know that she's getting enough?
Well, we want you to nurse her at least 8 to 12 times a day, and then you should be monitoring her output. She should have about 6 to 8 wet diapers, and then you know she's getting enough. And also her weight. You take her to her scheduled pediatric appointments, and they'll weigh her. But the wet diapers is a good indicator that she's definitely getting enough.
Okay.
Now, since you've just had this baby, we want to initiate early feeding within the first hour. That's going to help her latch on. And if she's too warm, like if she's showing that she's not really that interested, but she's been showing cues, you go ahead and unwrap her, wake her up a little bit, and then she'll latch onto the breast correctly. Now, the correct hold, you are doing one of them right now called the cradle hold.
Okay.
That's perfect. You're supporting her head and her back and her bum. Now there's another hold called the football hold, where you'll support her head and have the baby wrap around your hip. That's excellent if you've had a C-section. Now to initiate feeding, you're going to want to make a C with your hand.
Okay.
Is that comfortable?
I'm a little bit more comfortable with the baby this way, I think. Especially if I'm going to have to be using my other hand, so.
Okay. Yeah, lots of people find that the cradle hold is very comfortable. And that
Okay.
leaves your other hand free. Good. So you'll want to make a C with your hand, the thumb on top, and your fingers cupping underneath.
Okay.
And you want to stroke the baby's lip with your nipple.
Okay.
And try to get her to open her mouth wide like a yawn. Yep.
She's ready.
She's in good alignment. I see that, yep, she's straight from your elbow to your hip. And so then as soon as her mouth opens into a yawn, bring her to your breast. Very good. That's a good latch. Now, can you see her bottom lip?
Yes, I can.
Good. You want to make sure that's out.
It's out.
Yes.
And I can even see a little bit of her tongue.
Good.
Like in between.
That's perfect.
Like on the bottom of my nipple.
Good. And yep, I can hear a good suck swallow reflex. Do you hear that?
Yes.
Perfect. Now, if you want to release, go ahead and put your finger in between her gums, between your breast and her mouth, in between her gums. Good. That'll cause less trauma to your nipples.
Okay.
Okay. about
Thank
bottle
you.
feeding. You've already discussed with your pediatrician the brand and formula that you want to use.
Yes, I was surprised at the different choices in both the actual formula types, soy and
There are many. So I'm glad you discussed it with him to get the right food for your baby. And I see that you are in the correct position. You're supporting her head. There's milk full in the nipple. That prevents her from swallowing excess air. You'll need to burp her halfway through. Now, could you show me how you burp her?
Yep.
Oh, that's good. Yep, supporting her head, rubbing her back. That pressure on her chest in that upright position should get you a good burp every time. If not, there is an alternative, and you put them over your shoulder, supporting their head, and firmly pat their back. Good. Either one of those should work.
okay.
All right, now I also want to recommend that you never ever prop a bottle. You always want to hold your baby and have a visual on her. That's a great bonding time. And also, if you prop your baby and you walk away, she might choke. So always hold her while you're feeding her.
Okay, thank you so much.
You're welcome.
Hi.
Hi.
How is it? How's everything going so far
Very
with your
well.
new baby?
It's going good.
She's beautiful. Now, I know we already talked about infant seat safety, and so I just wanted to kind of recap for both of us so that I made sure that I covered the pertinent facts for you.
Okay.
Could you please tell me what type of position and where you would place the baby seat?
Well, you told me the baby should always be in the back seat, rear facing, and in the middle when possible.
When possible, that's correct. Great, that's great. That lets me know that you're remembering everything. If you're ever feeling insecure about anything at all, as far as the placement goes,
Yes.
Just weights adjust and cars adjust, making sure that it's strapped in correctly, you can stop at your local fire station or police station, and they will come out and assess that for you.
That's good to know. Thank you.
It'll give you good peace of mind. And then lastly, I just want to remind you that I know, like, sometimes having multiple cars, it's easy just to grab a second car seat from somebody who already had one.
Yeah.
But there's expiration dates on the back, or another good rule of thumb is like 2 years from the date of purchase or the manufacturing date.
Okay.
So that's a good kind of rule of thumb. And again, you can check at the police or the fire station. So.
All right. Great
Okay.
info. Thank you.
Okay, now I'm going to continue talking to you as part of your discharge again. I know you're excited to get home, but we really do need to review some things.
Okay.
One of the most important things to review is how your baby's going to sleep safely.
Okay.
And I know there's probably a lot of people tell you one thing over the other, but evidence-based practice has shown that a baby lying flat on his back, either in a sleep sack or swaddle, with nothing around, not any blankets, no bumper pads, no toys.
Oh, I just got
In
her
the
a
middle
cute little stuffed animal.
I know you can still keep it in the crib for pictures and stuff, but just when they're sleeping, when they are in there unattended, you need to have everything out of that crib.
Okay, I'll put it on
It's so easy if they do wiggle around to suffocate, and that's the number one cause of infant death is sudden infant death syndrome, which is basically they're suffocating.
Okay.
They didn't used to know what the cause was. They weren't sure what caused it, but mostly it's suffocation. It's also important not to ever fall asleep with your baby. There's been many instances where mothers or fathers have rolled over their baby.
Oh,
I know you want to be by them, but I'm sure you'd rather have them around to be by them.
Yes. I will put my baby on her back to sleep with nothing in
Right.
the crib.
Okay. Not even any snuggle in here. They can suffocate if you both take a nap. If you're feeling tired at all, it's best to put the baby in the crib.
Okay.
On their back. Oh my God, what do you want from me? I'm so tired. I haven't slept. You're just crying all the time. I don't know what you want. I want to help you, but I just don't know what you want. What do you want from me?
Let me have a turn.
The next area that we're going to be covering is infant skin care and diapering. In regard to infant skin care, it's important to understand the normal condition of the skin. One thing that parents need to understand is that milia will exist on infants. They resemble small insect bites or pimples. It's critical that they know that these will disappear without any treatment and that they should not squeeze them. Secondly, infants have dry skin which becomes softer after peeling, so parents don't use lotions or creams as this may cause irritation. Secondly, in skincare, it's umbilical cord care. Make sure that when you do clean this umbilical cord area that you clean it with plain water and keep it dry. Make sure you fold the diaper below the umbilical cord. This cord will fall off in about 10 to 14 days. And if you notice any signs of bleeding or signs of infection, make sure you let your doctor know, as this is very important for them to keep track of. Second, the other area that we're going to cover is diapering. In regard to diapering, make sure that you clean the area that covers the diaper, that the diaper covers with each diaper change. One area to be very careful about is the gender-specific instructions. Make sure with girls that you wipe from front to back, as if you move the stool around or move the wipe around, it might move stool into the vagina or the urethra, causing urinary tract infection. With boys, make sure that you wash the penis and also wash under the scrotum to avoid any rashes. When you do change a diaper, change it frequently, avoid commercial wipes, and also use absorbent diapers so this can prevent diaper rash. Now, if there is continued redness from a diaper rash, you need to change more frequently. Use petroleum jelly or something like a Desitin to take care of the rash. If it persists, just let your doctor know. Now, what I'm going to do very quickly is just give an example of a diaper change. Now, I'm using my daughter's doll. One thing you want to make sure when you do clean is that you wipe from front to back, especially if there's any stool. Take a wipe, clean, especially around the labia majora in the girls, and clean around the penis and scrotum for the boys. And before you replace the other diaper, or take away the other diaper, make sure you have a clean one underneath with the tabs on the bottom. Take away the dirty diaper, replace it, and if there's a rash, you can add either that zinc oxide or petroleum jelly. Make sure when you also, as I mentioned before, fold below the umbilical cord. And how to change a diaper, I'm going to talk about another important aspect of infant skincare, which is bathing. Now, the two types of bathing are sponge bath and tub bath. I'm not going to go into demonstrate both of those. I'm just going to do a general demonstration of what those two types are, and then we'll look at the screen to see what specific supplies and everything that you need. But there's a couple key points to remember for both tub baths and sponge baths. It's important to know that bathing is not necessarily necessary every day, as infants are often washed up after they spit up and after they and that diaper changes. Secondly, temperature regulation is very critical. Body temperature needs to be a minimum of 98 degrees. And when you do fill the sponge bath or the tub bath, make sure that the water is between 100 and 104 degrees Fahrenheit. Now, taking the baby that we used, one thing that's critical to do whenever you give a bath, make sure that the baby is first covered up and still dressed. It's critical, first of all, that you give the baby's bath with making sure that the head is done first. Okay, so imagine that there is water in here. What you want to do is make sure that you put the soap onto the baby's head. Make sure you wash, and then once that is done, then you can take out, and once you dry the head, then you can take off the clothes and take off the diaper, and then with each body part that you wash, what I would recommend doing to make sure that you keep the body temperature at a good temperature, uncover each body part. Now, obviously, for the sake of time, I cannot go through every part of this, but these are the key parts that you need to remember when you are talking about bathing.
Thank you.